Morning. Can you hear me okay? Wonderful. It is truly an honor and a pleasure to be here, everybody. Growing up when I was a kid in India, Tata Memorial Center is, of course, one of, if not our most acclaimed cancer centers. And so to feel like I can get to come here and stand in front of all of you and speak is an honor. So I want to say thank you for having me. I, during the early days of the pandemic, stopped using slides, and I'm hoping that it's one of those things that I never have to go back. So I hope that what I will do is speak for about 25, 30 minutes. There are a few points I want to make and a few things I would like to share. And then my hope is that we can have a conversation. You can ask me questions about really anything that I mentioned. And as I was thinking about today's talk and what I might want to share, I thought about the very cliched line from Charles Dickens in his Tale of Two Cities, where he says, "It was the best of times, it was the worst of times." And as I think about the moment we are in the world, I think in some ways that captures many of the issues that we are facing. And maybe because I am an optimist, I always see the best of times as actually the most important or the more important of the two. But I want to start off by talking about some of the challenges that we face as a globe. And the frame I want to do this in is in the frame of thinking about the era we live in. And the era we live in, and eras, by the way, can only be seen in retrospect. So somebody will write a book 20 years from now and will describe this period as a period of the birth of biology and really of biological engineering and a revolution in biology. And we have lived through lots of eras. In the 1890s and early 1900s, you had fantastic scientific work being done by Madame Curie, by Ernest Rutherford, Fitzhaber. And that was an era of chemistry, where we learned how to manipulate and engineer chemistry. And it led to incredible gains, the ability to make plastics. And if you just think about how much of a revolution plastic is in everything we use, it comes from that era. And then, of course, in the 20s and 30s, we had a different scientific revolution, one of physics, right? When I think about people like Niels Bohr, and of course, Einstein and relativity, Heisenberg and the uncertainty principle, Max Planck and the whole birth of quantum physics. And that revolution in physics has led to so many of the things that we use today in this hospital. Radiation therapy, all the nuclear testing and the ability to use isotopes to do diagnostics. So these revolutions, these scientific revolutions, have enormous benefits. And I would argue that in the last 15 years, we've had a similar revolution in biology. Think about people like David Baker and the work that he's done on understanding how protein synthesis and protein folding can work. Jennifer Doudna, who's and the ability to edit genes. And Caitlin Carrico, who also won the Nobel Prize for her groundbreaking work on mRNA, and the ability to use mRNA to come up with vaccines, of course, but also therapeutics. And so I think when we look back to this era, we will see it as every bit as consequential as the eras of chemistry and physics. This is the era of biology. And the good news is for all of us, those of us who are in medicine and public health and biological sciences, this is going to be our era. This is going to be the era where we are going to have enormous influence on the world. So that's very exciting. But there are some very, very substantial challenges. And I'm going to spend maybe 5-10 minutes talking about some of those challenges. And then I'm going to hopefully spend the last 10 minutes before we open it up to talk about why I still think this is the best of times, why I still think that the collective brain power in this room and rooms like this are going to be the solution to the challenges we face. So the first set of challenges I want to talk about is something that we all just lived through over the last 5 years, right? Which is, of course, the COVID pandemic. In 2018, I said almost at 1918. I was not around in 2018. I was giving a talk. It was the 100th anniversary of the flu pandemic of 1918. And I was speaking about the era we are in, and I said, we are in an era, we are in an age of pandemics. And people said, well, it's been 100 years. And I said, that is the thing I worry about most, is we are going to have a pandemic. And why did I say that? And I want to spend just 2 minutes talking about why I think COVID was not a once-in-a-century event, but a harbinger of what is to come in the years ahead. We are going to see more and more things like COVID. And this is not meant to scare us, it's meant to prepare us, to get us ready so we can manage that. So why did I say that? Why do I think that? So if you think about where pandemics come from, why do we get pandemics? Pandemics happen on a very basic level. Pandemics happen when you have a novel virus, can be a bacteria, of course, as well, or any pathogen, in a population that has no immunity, and a pathogen that can spread easily. Those are the formula. That's the formula, right? Where do most novel pathogens come from? Most of the time, they come from animals. They come as spillovers from animals. That is not my way of saying where I think COVID came from. Different conversation. I'm happy to talk about origins of COVID. But if you look throughout history, that has been mostly where novel pathogens have come from. And then if you look at what has been happening in the world, we're seeing more and more spillover events. We've had 3 novel coronaviruses in the last 20 years, SARS-1, MERS, and of course, SARS-2. And if you just count the number of novel pathogens that have shown up in human populations, it has gone way up. Why? Number one is the increasing interface of humans and animals. Deforestation, economic development means in more and more parts of the world, humans are going into habitats they didn't before. A related phenomenon is climate change. Climate change is moving where vectors are. And that means, of course, that we're getting new vectors showing up and new pathogens showing up where they hadn't before. And then a couple of other things I think are important. The third is urbanization. Humans as a species has been a rural species. We have lived in rural areas throughout all of human history. And in the last 100 years, that started to change. And about 10 years ago, we think somewhere around 2015, we hit the 50-50 mark, where half the world now lives in cities. And by 2050, that'll be about 65%. That urbanization means that a virus that would have affected some one person in a rural area, maybe affected 20 or 30 and then died out, hits cities more and spreads a lot more efficiently. And then last but certainly not least is globalization. And globalization means that a virus that lands in one city can become global very quickly. And I always just remind people that if you look at China in 2003, when SARS-1 broke out, versus China in 2019, when SARS-2 showed up, domestic travel in China had gone up 20-fold between 2003 and 2019. And international travel out of China had increased 40-fold, 40x. If you just think about India, think about domestic travel in India 20 years ago versus what it is today. And I flew in last night from Delhi. The number of flights from Delhi to Bombay between 6 and 8 p.m. And like there are 10 flights. Like we have become, as a country, India has become incredibly deeply interconnected. By the way, I think that's a good thing. I think it's wonderful. But it has costs from a biological spread perspective. So put all of that together, and there's no question in my mind that we are entering a period where we're going to see a lot more multinational disease outbreaks. That is just a truism. There's one other phenomenon. This is still part of the worst of times. Then I promise I'll get to the best of times. One other phenomenon that is important. So I talked about these great scientific revolutions that we've had, the great scientific revolution in chemistry that gave us so many wonderful things, including plastic. It gave us one more thing. The scientific chemistry revolution that I was describing, the ability to engineer chemistry in the 1890s and 1900s, gave rise to the first use of chemical weapons in World War I. One of the things that always happens when you learn how to engineer a basic science is people weaponize it. And you know where I'm going with this, because the great physics revolution of the 1920s and 1930s gave us the nuclear weapons of the 1940s. All the benefits, but also the weapons. So the great biological revolution of the 2010s and 2020s, the period we're living in, will give us a whole new generation of biological weapons that we will have to contend with. And when I say we, I mean policymakers, society, but who's going to be on the front lines of that? The doctors and the nurses and the scientists who are going to be called upon to deal with that. Right. So these are the challenges that we have in front of us. And none of that, of course, even mentions a lot of the other things. We have an increasingly aging population. We have growing rates of obesity, not just in the United States, but in India and everywhere else. And that will, of course, mean that the burdens that you all face and manage on a regular basis will only grow. We are going to see the incidence of cancer has been increasing in the United States, in India, and everywhere in the world pretty substantially, and that will continue in the years ahead. So we are facing difficult times indeed. So that's the Charles Dickens, it was the worst of times. Pandemics, biological weapons, growing rates of cancer, it all sounds terrible. And it's not, it's hard. So let's now talk about why I think it's the best of times. Because everything that is giving us rise to these challenges is also giving us the rise to all of the things that we can do to solve these problems. So let's take each of those on directly. I actually think the strategy on how to think about pandemics and biological weapons is actually very similar. And in fact, in many ways, it's also similar to how we deal with the rise of chronic diseases like cancer. So one of the things I say to policymakers, look at that, got a little bright. People often say, well, we should figure out how to prevent pandemics. And my argument is, sure, that's going to be very, very hard, right? Because if I told you that the reason we're going to have more pandemics is because of climate change, urbanization, and globalization, what are we going to do on those three phenomena? And I'd argue there's nothing to be done. We should slow down climate change. We should burn less carbon. But urbanization is here. We're not going to get people living in cities and send them away and say, no, go live in rural areas. It's not going to happen. And we're not going to end globalization. We're not going to say no one's allowed to travel, too many flights. That's not going to happen. So if those factors are there, then my view is we are going to have more outbreaks, more pandemics. Can't prevent. Then there are a lot of people who think, well, can we predict these things? Can we come up with a prediction algorithm that says this is going to happen on this date? I will tell you, if you'd asked me in 2018, and I was asked this, when would we have the next pandemic? Of course, the answer was I didn't know. And then somebody said, what kind of pandemic are we going to have? I said, oh, I have a pretty good guess on that. It's going to be an influenza pandemic that probably starts in Southeast China. Turns out it wasn't virus that started in China. It was not influenza. It turned out to be a coronavirus. America has extraordinary labs, incredible resources, great scientists. The fact that we could not stand up the kind of testing infrastructure that India did is remarkable. It's more of our failure India on this one has been really quite successful. But I think making sure that all of the learnings of rapidly building up a testing infrastructure is not lost is going to be very important. If a pandemic is because you have an immune naive population and a novel virus, obviously one of the critical things to do is to build up immunity in the population as quickly as possible and as safely as possible. And the best way to do that is through vaccines. Now here, I have 2 or 3 things I think are worth mentioning. First is there are only a handful of countries that built high-quality, indigenously developed high-quality vaccines. The US, the UK, you could argue Germany, right? BioNTech working with Pfizer, and India. The Chinese also built vaccines. I have gotten into some trouble in the past when I have said this, but I don't think their vaccines were of particularly high quality. By the way, I made that comment once I was at the White House. It led to the Chinese ambassador to the US making a phone call to the president's national security advisor saying, why is your COVID guy criticizing Chinese vaccines? Luckily, no one cares what I think anymore. So I can now honestly say, I still don't think they were great vaccines. But I think there are a small number of countries that demonstrate that you can build high quality vaccines, and India is one of them. I think it's a remarkable fact, by the way. But there is one problem with the vaccines that is that we were in some ways lucky how quickly we were able to develop them. We knew a lot about SARS from SARS-CoV-1. And that's why we knew that you could target the spike protein, for instance, when you think about the adenovirus vaccines or the mRNA vaccines. If we had a novel pathogen that we don't know as much about, it may take us longer to build vaccines. So one of the things we absolutely need to be doing right now is investing in the science behind vaccine development. And one of the things that worries me immensely is that the American scientific enterprise, which is really quite a great scientific enterprise, NIH, the academic medical centers, the major universities, the Dana-Farber's, all of those. There has been a huge cutback in the last 2 months by the new administration on vaccine studies. Almost a deliberate decision to say we're not going to invest in the science of vaccines. I think this is a terrible mistake, and I have said as much. But it also creates an opportunity for others to invest more in this area. And that is something I would ask that we all in this room and policymakers in India think about. Because if US really withdraws in its scientific leadership on vaccines, then we're going to need other people to step up. So I think that's extraordinarily important. Just a couple more things, and I'll wrap up. Beyond vaccines, of course, there's also the importance of treatments. And here, I think the broad investment in a whole new generation of therapeutics is going to be very, very important. And these investments in treatments are not just going to be beneficial for pandemics. So yes, of course, treatments like monoclonal antibodies and small molecules against viruses is going to be very important. But the basic science investments that we need to make, and again, America has been very good on this. I'm starting to see a lot of really innovative things coming out of India as well. Will have huge benefits. I mean, I just think about all the progress that is being made on cell and gene therapies. Right? It will have incredible benefits, yes, for getting us ready for future disease outbreaks, but also for managing the challenges of our times. I mean, I just think about how much cancer treatment has changed in the last 10, 15 years. I'm a general internist, internal medicine physician, so I don't have any business talking to all of you about cancer treatment, since you actually know a lot more about it than I do. But as an outsider who takes care of a little bit of cancer patients, mostly with oncologists, but just as an internist, I am struck by how much our thinking about cancer has changed in the last 15 years. Cancer no longer is even just thought about primarily as an organ-based thing, right? We always thought about this as all breast cancer is the same, all lung cancer is the same, all liver cancer is the same. That is not the way we understand it. And I think the basic investments in genetics, all of the same things that are creating the problems, that is also giving us solutions to think about therapeutics in a very, very different way. So I think substantial scientific investment in this area is going to be very important. And then last but not least, and maybe this is more of a problem for America than it is a problem for India, is the issues around trust in medicine and public health. And I'll be curious, maybe in the Q&A we can discuss this. One of the things I worry a lot about in the US is if we get a new pandemic, let's say bird flu, H5N1, we're seeing real problems with bird flu in the US. Let's say it becomes a human pandemic. We can do surveillance, we can do testing, we can build a vaccine. We have some vaccines, we can build better ones. We even have some treatments. There's a huge question of will people take it? Confidence in vaccines has declined a lot. Confidence in public health has declined a lot. And so you can build the best biomedical infrastructure, but if people don't trust it, it's not going to work. And so that's something that is a huge challenge for us in the United States. How do we rebuild that trust? How do we make sure that people understand the benefits of this huge biomedical enterprise? My sense is, and maybe you'll correct me, is that is less of a problem in India. That in a country that was ravaged by, for instance, the Delta wave, there was very rapid uptake of this incredible vaccination program that India then rolled out after Delta. Right? And that people still have a very high degree of trust in medicine and in the hospitals and the public health system. And preserving that is going to be very, very important for these future biological challenges. So let me just wrap up by saying that the challenges in front of us, pandemics, biosecurity, aging population, increasing incidence of cancer, all of those are real challenges. And if you're a negative person, you can say, oh my God, these are the worst of times. But if you look at what is happening in institutions like this, the incredible medical care that you're all delivering, the translational work that is being done, the ability to do everything from genetic therapies for sickle cell to CAR T, to all of these huge gains that we are obtaining. If we continue making these investments in the scientific enterprise, we continue developing an ecosystem of new and innovative companies in the biotechnology space, I actually think all of these challenges are very manageable. And we will look back 20 years from now and not just say that it was an era of biology, but we will say it was a golden era of biology, where our ability to manipulate biology, to engineer biology, yes, it had some negative effects, but actually opened the doors for us being able to protect society and address so many of the challenges that feel hard to address today. So let me just stop there and say thank you so much again for having me here. This was really an honor and a pleasure. I think we have about 15, 20 minutes for questions, comments, disagreements. If any of you have disagreements with anything I said, but let me stop and take questions. Thank you very much. Please don't be shy.
So thank you very much, Professor Jha, for your wonderful talk on a range of issues. Any questions or comments from my colleagues, Dr. J.P. Agarwal?
I'm always impressed with whoever is the first one to have courage, so thank you very much.
I'm not a pessimist.
Good.
That's my declaration. So you mentioned plastic twice.
Yeah.
So every effect has a good one and not so good one.
Yes.
And now we are in a deluge of a plastic which is akin to pandemic, affecting every human being
Yes.
or any flora and fauna. So which happened 100 years back or 150 years back, now affecting us in a very good ways, everything, but in a very, very bad ways.
Yes.
So we need to know how to mitigate it, how to curtail it, and the same stands for the vaccinations.
Yes.
If we do a global vaccination for everybody, so there are going to be some not so good effects.
Yeah.
So we should be working on a sustenance basis on those effects. Unfortunately, I don't see the work, at least in Indian scenario, or not in the peer review journals. So what do you say about it?
Yeah, it's a great point. It's a fantastic point. And let me say a couple of things. And obviously, I don't have a simple answer, but let me give you my reflections. I did say plastics twice. I think plastic as a revolution was extraordinary. It has all sorts of benefits. And in some ways, you don't even realize it. Like today, if you have a chance, and again, you are very busy people with much more important things to do. But as you go through your day, just think about every time you touch something that is a plastic. Think about what a revolution it has been. But it is also striking. You can look at, I mean, oceans are now filled with plastic. There are microplastics get into our bodies and have huge health effects. I'm not a plastics expert, even though I said plastics twice. So I'm not going to talk too much about plastics and what our strategy on plastics should be, except we should figure this out. It's a very big problem. But you did talk about vaccines. And actually, I'll make, I think, the broader point you were making, which is we have one kind of problem as people, which is that we tend to want to put everything into a bucket of this is a good thing or a bad. I have that same tendency and problem, by the way. So, because I'm a human and I have the same fallibility that all of us. So when it comes to vaccines, I am very pro-vaccines. And I find myself at times talking about vaccines as though they are perfect, they have no side effects, there are no problems, it's all good. And of course, you understand why I do that, because I live in a country where my health secretary is convinced that vaccines are the cause of most of our problems. And if we stopped vaccinating people, everybody would live longer, healthier lives. So sometimes to counter that, I go to the other extreme. So you understand that that is a fallibility all of us have. But the broader point that you're making, which I think is absolutely right, is we can be very pro-vaccines without needing to ignore the fact that some people are injured by vaccines, without needing to ignore the fact that some vaccines are good, some vaccines are excellent, and some vaccines are okay, probably useful, but maybe not always. So I think being able to take a more nuanced approach to these issues is very, very important. And not letting ourselves, scientists, medical practitioners, get caught up in the black and white of this is good, this is bad. We all understand this in medicine very well, by the way, that almost every treatment we have, use the wrong dose, and it becomes poison. Or totally ineffective if you use too low a dose. So we understand these things intuitively, but we need to practice it more in our scientific and in our policy conversations. So thank you for that.
I'm Ajay Puri from the Department of Surgery. Thank you for an excellent talk.
Thank you.
And you highlighted the challenges to us. And as a head, when someone comes to me with a problem, I tell them, if you've come with a problem, give me the solution as well.
Sure.
So I'm going to extend that same question to you.
Yeah.
But yes, as a health scientist, you think of policy based on scientific data, et cetera, et cetera.
Yeah.
But implementation of that policy very often depends on bullheaded bureaucrats and politicians, like you rightly alluded to. So tips on how do we navigate that when even in the face of overwhelming data, they don't seem to agree with us.
Okay.
And second part of that question, which you spoke about, trust in the population.
Yeah.
Yes, though not as bad as the US, we see a little of eroding trust here as well.
Yes.
And sometimes I think we are partly responsible for that as well.
Yes.
Because in this intense era of marketing, we sell miracle cures, etc., which always don't translate into it. So your tips and suggestions as to how we tackle both these.
Yeah. Anybody else have questions? No, I will answer both of them. Those are good questions, and they're very hard questions. So let's talk about bureaucrats and policymakers. For better or worse, over the last 5 years, I have had a chance to interact with many of them. And they are interesting people. My overall view is most policymakers, now, my experience has been almost exclusively in the United States. And it's also been voluntary, meaning there are plenty of policymakers who have not wanted to interact with me. So most of the interactions have been with people who are open to interacting with me, right? My personal view is most policymakers care deeply about people and well-being and want to get the answer right. Not everybody agrees with that assessment, but that has been my personal experience. They also have a very hard job, which is their job is to balance a variety of different factors. One of the downsides of living in a democracy is you have many loud voices telling you, if you're a policymaker, what to do. It's also one of the upsides of living in a democracy, right? Democracies are messy. And I do believe in the old Winston Churchillism of democracies are the worst form of government, save everything else, right? Like it has all sorts of problems, but what else would you want to live in? So I'll give you one quick story. In November of 2020, so before we had vaccines in the US, we were having a terrible outbreak in one of the states in the US. And we were in the middle of the election and the president wasn't paying attention. And I was speaking to a governor of a major state. And the governor brought up, was talking to me about this terrible outbreak and what to do. And I had a list of 5 suggestions from my public health expertise and perspective. And the first one I gave was, I said, look, in this community where you're having a terrible outbreak, your bars and restaurants are all fully open. Maybe shut them for 2 weeks, because bars and restaurants, people spread virus very effectively. Take a 2-week break. And this governor, going to by Zoom call, says to me, that's an interesting suggestion. What else do you have for me? It was very clear they weren't going to do that. I said, okay, I've got another. And I went through my list of 5. And the governor ended up doing 2 of the 5. And then afterwards, the governor's chief of staff called me and said, you know, very thankful, thank you for your suggestions. I hope that you understand that. And I said, no. I'm just a public health scientist. I don't run a state. I have no accountability to the people. If I make a mistake, it's unfortunate, but I am not accountable. A governor is accountable. Chief minister right here, right? The equivalent of a chief minister. And that chief minister is accountable to the people of that state. So at the end of the day, it is right that policymakers listen to scientists, factor that into their decision making. But they don't always do what we say. And as frustrating as that is, I actually think sometimes that's right. So one part of me just says that it's important to understand the role of science in policymaking. It's one factor into the decision. It is not determinative. But that only works if you hold people accountable when they mess up. One of the things I worry a lot about is a lot of times political leaders make very bad decisions, and then they're not held accountable for it. And that's really a failure of our democratic process. But the bigger picture point here is, what I would say to all of you is, you will have opportunities in your life to engage with policymakers, whether they be bureaucrats or elected officials. You should give them your best advice. And if they don't listen, it's okay. Go back again and again, because sometimes they can't based on a variety of things. To your second question of trust and how do we make sure that we don't see further erosion of the trust, I think a lot about why we lost so much trust in the pandemic in the US, and maybe this holds lessons for your question here. There was a tendency, and there's a tendency among public health experts, to provide a degree of certainty that we don't actually have. To say things like, don't worry, no need to panic, this is the answer. By the way, the best way to make people panic is to tell them they don't have to panic. I never say don't panic. Because then people think, oh, I wasn't going to panic. but now maybe I should panic. And so, not useful. Often the public health experts, and I tried again not to do this, but I'm sure there were times where I failed as well, but I tried my best to talk about uncertainty, what we don't know, how we're going to learn, what our best estimate is. And you are right that in medicine, and especially in the world of kind of marketing, we market miracle cures. And by the way, some of what we're able to do today is miraculous compared to 20 years ago. No question. But actually, it's very important from a communication point of view when you're with the patient or you're talking to a broad audience to acknowledge the limitations of what we know. Right? We have made enormous progress, and I keep coming back to thinking about cancer treatments. We've made enormous progress. And yet we have so much further to go. There's so many people we can help, but there's so many people who we don't help as much as we want. I think being more humble in our communication, maybe telling the marketing people to tone it down a little, but certainly in our individual conversations, acknowledging the weakness, not the weaknesses, but the uncertainties and the limitations of where we are is, I think, very, very important.
Online question
Online
from
question.
the director of the Homi Bhabha Cancer Hospital in Vizag, Dr. Mahan Shetty. Dr. Mahan Shetty, please go ahead.
Thank you very much, Dr. Siddhi Gupta. Thank you, Dr. Professor Jha, for sharing your thoughts on the public health problem. So I had a question related to the plastic issue. Well, we have reached a point of no return or probably minimize the issues related to plastic. And the same story probably is repeating with e-waste. And now, in recent past, also electrical vehicles, the batteries, how to be disposed. And my problem is, I want to know your thoughts. Do we really address till the real end of what the product would do to the environment before we jump into, let's say, a sort of pandemic in using them? Thank you.
Yeah, it's a very good question. So the short answer is we don't do that. We don't spend enough time. And again, it's kind of, I mean, probably not the best analogy of vaccines versus electric vehicles, but electric vehicles are wonderful in certain ways in what the problems they solve. But just as I said that almost everything that's creating a problem is the nexus by which we create solutions, every solution seems to have a nexus by which we create the next set of problems. It's almost like there's a yin-yang here, right? And you're absolutely right that we jump into things without thinking through how are we going to solve the problems that this solution creates. Because our brains are sort of wired towards thinking about problems and solutions to problems, but the solutions then create the next generation of problems. You know, there's a little bit of history of our strategy as humanity is to say, let's solve this problem, whatever problems it creates, we'll solve that later. And sometimes that works, but often it doesn't. So what it actually calls for is a bit more of a deliberate approach that says, it isn't that you should not, for instance, use electric vehicles. But just as we're pushing for more electric vehicles, because again, electric vehicles have a lot of upsides, a lot less pollution, less carbon burning, less smog and everything else, we don't need to wait until the problem becomes full-blown before we start addressing it. Just as we're pushing out the solutions, we've got to start thinking about what problems will it create and how do we begin to work on solving them now. So maybe the call here is for earlier understanding of the problems and earlier work on solving it. Otherwise, what you don't want to do, I think, is look at the problems it will create and say, no, let's not even do that. Because the alternative is what we have now, which is not great.
Thank you.
Thank you.
Are there any other questions or comments? Yes.
Thank you, Dr. Jha. I'm Girish, pediatric oncologist here. So my question is, you said this is the era of biology and biology has led to innovations and in cancer therapeutics, of course, We are seeing huge inroads made to understanding of biology. But the innovation is not accessible to vast majority of the world.
Mhm.
So my thing is that when a country like US or Europe gives approval for new innovation, is there any thought process or a framework that this should be made accessible for rest of the world rather than keep it only for the and rest of the world really is in agony, not able to get access to most of these innovations which occur? Things like, can the patent period be much smaller? Does it need to be 20 years? And can technology be shared earlier? Is there in the governmental sector any discussion or in global organization, these kind of things? Because at the end of the day, biology is not helping 80% of the world population.
Yeah, very important question, very important. Um, it's a different version of the question that, or the statement I made, that if you can build the best, most impressive, innovative technologies, but if no one trusts it, it won't work. If no one can access it, it won't work, right? That is your point, that if we have great therapeutics and no one can get it. I'll give you an example of this in the US that we're struggling with right now, and then I will get specifically to your question about global access. We have largely figured out how to solve sickle cell disease. We now have gene therapy for sickle cell disease. There are 100,000 Americans with sickle cell disease, and you are all of you who are clinicians know that sickle cell disease, not the trait, but disease, it's a terrible disease for most people who have it. Lifelong crises, strokes, pulmonary embolism, all sorts of other problems, pretty awful. And we now have a treatment that can cure it, right? It can change the hemoglobin production that goes on in the bone marrow through genetic treatments and make people better forever. The treatment cost in the United States for this is $3.5 million. And there are 100,000 people in America alone who have sickle cell disease. And if you just do the math, that's a $350 billion cost to cure the 100,000 people. 1 lakh aadmi, right? 1 lakh people. $350 billion. So what's the effect? Is almost completely inaccessible in the United States. Forget the rest of the world. So what to do? And the fight inside the United States and Europe is, if you say, look, we have the treatment, we should make this now accessible to everybody, forget the patents, the companies will come back and say, okay, you can do that for this disease, but no one is going to invest in building the next treatment without patents because you need the financial incentive. And this is the fight we've been having for 20 years. And I believe we've made very little progress on that. And so I don't want to keep fighting over things. Like, my general view is we have got to figure out what the solutions are. And I will be very honest, I think the chances that we're going to have a dramatic reduction in patent time period, I don't see it. It's not, America won't do it. Europe definitely will not do it. The whole global pandemic accord that was an attempt to try to think about in the next pandemic, how do we share vaccines and treatments more rapidly, all collapsed over this issue. So saying, yes, we should do this, sure, I can just say that, but it won't work. So what might work? How do we actually make progress? So first, I think innovations have to come from other places as well. CAR T costs $500,000, $500,000 in the United States. Turns out, you all know this very well, given where we are. There are other places I can do innovation in CAR T. Now, CAR T is very specific, but at much lower costs. So we need to see innovations like these coming from places outside of US and Europe, and I think we're starting to see more of that. That's going to be one part of the solution. Won't be all of it. But to the extent that India becomes a major innovator for biological sciences, it will automatically open up markets a lot more, because those innovations will be less expensive. Second, I think we need to come up with creative solutions on this. I think about one of the most successful programs in this area was PEPFAR. For those of you who don't know, it was called the President's Emergency Program for AIDS Relief. This was created by President George W. Bush in 2003, if I remember. And we had this problem where we had incredibly effective treatments against HIV, and the entire African continent could not get it, and people were dying. And the point was, what's the point of having this wonderful treatment if only a small number of people with HIV can get it? And George W. Bush, in probably the most important global health program of the last 50 years, launched this program to get low-cost drugs to the African continent. And we were able to do it in a way that drug companies went along. So I think we just have to take every one of these topics and say, how do we create a solution where the reality will be that Americans will pay a lot, the Europeans will pay a lot, but a little less than America, but the rest of the world gets access at a much lower price, called market segmentation. And we've got to be able to do this through kind of creative policy strategies, because I think the broader fight on patents, I was more sympathetic to that fight 20 years ago. And maybe it's just all my gray hair. I have decided it's a fight that we just don't make progress on. And I'm interested at this point in how do we make progress. So I think again, I think it's fine if you want to talk about we should reduce patent times, but it's very hard. And the politics of it, I used to think the politics of it in America were bad. The politics in Europe are even worse. So I don't see that becoming a reality. So more innovations in other places and more creative policy solutions where we have segmented pricing. We've got to just push on those as two of the solutions we're looking